This PowerPoint presentation is about Placenta Previa.
In this presentation, you will learn about placenta previa, its pathophysiology, manifestations, diagnoses and expected outcomes, treatments, and nursing care.
Placenta previa is a condition where the placenta incorrectly implants and attaches to the uterus. Rather than being in the upper portion of the uterus, it implants in the lower part. There are 4 grades to placenta previa. Each indicates how much the placenta covers the cervical os. The cervical os is the uterus's opening to the cervix. Grade 1 placenta previa is where the placenta lies in the lower segment, but it does not cover the cervical os. In grade 2, it reaches the margin, but it does not cover the cervical os. In grade 3, it partially covers the cervical os, and in grade 4, which is the most severe, it completely covers the cervical os. Although the cause for placenta previa is unknown, there are some risk factors associated with the condition. These can include smoking, mom being over the age of 35, any form of uterine trauma, such as a C-section. Often, the only symptom of placenta previa is painless, bright red bleeding. It usually happens in the 2nd trimester. The bleeding is caused by contraction and dilation of the lower uterine segment. When it does this, the placental villi are torn from the wall, making the uterine sinuses exposed. The amount of bleeding depends on how many sinuses are exposed.
Diagnosis: placenta previa may be asymptomatic. It may present with painless vaginal bleeding. It's done through ultrasound and monitoring progression. It can be both slowly or rapidly. It ends with the delivery of the fetus and the placenta, and there are restrictions. Outcomes are the patient will most likely deliver prior to EDC, both vaginal or cesarean delivery options. The potential is there for a hysterectomy. This is done as a last resort. Use caution during pregnancy. Healthy mom and baby. Patient education revolves around safety precautions for both the mom and baby. The education related to vaginal versus cesarean delivery and the possibility of a hysterectomy. Treatments include amniocentesis to check the baby's maturity. Slow progression would dictate other medications, including ROGAM. Non-pharmacological interventions would be change in diet to prevent bleeding, decrease in activity, including sex and exercise, decreasing travel to reduce stress, minimal, if any, digital exams, and other general safety precautions.
Appropriate nursing care for the patient with placenta previa is important. A priority nursing diagnosis. The main goal for the patient with placenta previa is to prevent significant. When monitoring for vital sign changes, you need to observe for such. Laboratory values need to be closely monitored and assessed. When assessing the mother with placenta previa's history,
For review, placenta previa has a cardinal sign of which of the following? The correct answer is A, painless vaginal bleeding. An additional review question. Risk factors associated with placenta previa include select all that apply. The correct answer is A, smoking, B, uterine scarring, B, multiple gestations in a short time span, and E, history of uterine trauma.
if you're interested in learning more about placenta previa,